Welcome to the deep dive. Today, we're getting into something called digital twins, specifically in healthcare.
Right.
And forget those old static models. We're talking dynamic virtual versions of patients, organs, maybe even whole hospitals
Yeah.
that actually learn and change over time.
Evolve with their real-world counterpart. It's pretty fascinating stuff.
Oh, exactly. So our mission today is to really dig into the sources we've got and pull out what's genuinely transformative about this. We're looking for those surprising bits, the key insights you probably won't just find with a quick search.
And what's really enabling this now, I think, is this convergence of technologies. It's not just clever software on its own.
Right.
We're leveraging huge advances in big data, just the sheer amount of information we can process now. Cloud computing gives us the power. VR helps us, visualize it all immersively.
And the Internet of Things, the IoT, right.
Yeah.
That's feeding the data in constantly.
Precisely. That constant stream of real-world data is what makes the twin live.
Yeah, and that's a crucial point, isn't it? These aren't just like digital blueprints, they're active, intelligent, virtual counterparts
Living entities in a way.
that can actually help optimize how healthcare works. And this is the really big one, predict future states.
Like how well a treatment might work, or the risk of something going wrong for a specific patient. That predictive power is key.
Okay, so our sources break down these digital twins into, 5 core components? Let's maybe walk through those first.
Sounds good, yeah. 5 key parts. First up is the physical entity itself.
So the actual patient or the heart we're modeling or maybe a medical scanner.
Exactly. And it's always generating data. Think that wearables, tracking heart rate, glucose monitors, advanced sensors built into hospital equipment, all sending data.
Got it. So component 1, the real thing and its data. What's next?
Component 2 is the virtual model. This is the digital representation, the twin itself. It captures not just the physical shape, but how it functions, how it behaves.
And this is where VR and AR come in for seeing it.
Right. Virtual reality, augmented reality, mixed reality. These let doctors and researchers actually visualize and interact with that virtual model.
I could see that, like a surgeon practicing on my virtual heart before the actual surgery.
That's exactly the kind of application we're talking about,
Yeah.
which leads nicely into the third component, the connections.
The link between the physical and the virtual.
Yep, the data pipelines. And this is where things like 5G become really important. You need speed and low latency to shift these massive data sets back and forth almost instantly.
And the human interaction side too, I guess, making it easy to use.
Absolutely. Human-computer interaction is vital. It has to be seamless for healthcare professionals to actually engage with these complex virtual systems effectively.
All right, physical virtual connections. It's number 4.
Number 4 is the DT data itself, all the information that fuels the twin. It's vast, it's varied.
So we're talking big data analytics here to make sense of it all.
Definitely. Finding patterns, making predictions based on all that information. And importantly, our sources mention using things like blockchain technology.
Ah, for security and trust.
Exactly. To keep all that sensitive health data safe and make sure it hasn't been tampered with. It's crucial.
Makes sense. And the last component, number 5.
The 5th is the DT service model. This is really about what the digital twin does, the services and actual insights it provides.
So the so what part.
Pretty much, yeah. And AI plays a massive role here, automating the analysis, learning from the data, making the whole system smarter and more responsive. This leads to, better, faster decisions in healthcare.
Okay, great overview of the building blocks. So let's get into how these are actually being used. Our sources talk about some really clever models for diagnosis, right? Especially non-invasive stuff.
Yes, that's a huge area. One really compelling example is in heart diagnostics, moving away from needing invasive procedures.
How does that work?
Well, instead of putting catheters inside arteries to measure blood pressure directly.
Which has risks.
Which has risks, yeah. They're using something called virtual fractional flow reserve. It analyzes data captured just from the surface of the heart.
Okay.
Then they use some pretty advanced math-reduced order models, machine learning, to build up a really detailed database of what realistic blood pressure waveforms look like based on that surface data.
Wow. So the computer learns to predict the internal pressure from the external signals.
Kind of. It gets even smarter. They use a neural network and AI trained on those surface waveforms, and it can predict the full range of pressure waveforms inside. It fills in the gaps.
Without ever going inside the body.
Right. And then they use another neural network with what's called an inverse model. It basically works backward from those predicted waveforms.
To figure out the cause.
Exactly. to figure out the underlying issue and detect how severe the disease is. It's a really layered, sophisticated, non-invasive approach.
That's pretty incredible. There was another method mentioned too, wasn't there? Something about offline and online stages?
Yes. That's a different approach. Two phases. The offline stage is all about preparation.
Building the tools?
Essentially, yes.
Hmm.
Running lots of high-fidelity simulations to generate tons of training data, then using that data to build the AI models and even create detailed virtual organs. You do the heavy lifting up front.
Okay, so you build the virtual world first. Then what happens in the online stage?
The online stage is about real-time analysis. It uses things like motion capture systems.
Like they use in movies.
Similar idea, yeah.
Yeah.
Capturing how a person moves. Then, inverse kinematics technology translates that movement into a digital skeleton in real time.
And that data goes into the AI model you built earlier?
Exactly. It feeds into the pre-trained AI and a visualization system. So you can analyze someone's posture or movement patterns instantly for diagnosis, maybe for physiotherapy or spotting neurological issues.
Right, I can see how that applies. And thinking bigger picture, how do these twins fit into the sort of broader shifts in healthcare, like telemedicine?
That's a great connection. Our sources really emphasize the potential here, especially with the rise of online medical services. Digital twins could fill gaps in care for, say, the elderly or people managing chronic diseases.
Or even preventative care, that sub-health group they mentioned?
Exactly. People who aren't sick yet but could be heading that way. And, the recent pandemic really drove home how much we need better remote healthcare options. Digital twins could be a big part of that.
It's not just physical health either, is it? The sources mention psychology too.
Yeah, VR is already being used in psychological treatment for things like exposure therapy. Digital twins could take that further by modeling life as a really complex system.
How so?
There's some pretty advanced research like Shuangming Yang's work looking at simulating nervous systems, even building biologically inspired cognitive supercomputers. It's about creating much richer virtual environments to understand and treat the mind.
That sounds very futuristic.
It is pushing the boundaries. But even conceptually, thinking of the digital twin as this. Multimedia format for all human body data is powerful.
They mentioned a slightly grim example, didn't they? Bacteria spread.
Yes.
Hmm.
Simulating bacteria spread in corpses. A bit morbid, maybe, but it illustrates the potential to model processes across the entire life cycle, health, disease, even after death, potentially giving us insights we just couldn't get otherwise.
Okay, let's bring it back to more immediate applications. What are some concrete examples our sources gave? Complementary therapy.
Right. Imagine an immersive interface, maybe VR, where you interact with a virtual doctor or nurse. But this isn't just a generic avatar. It's powered by your digital twin, offering truly personalized advice and care based on your specific virtual profile.
Tailored care. And cardiovascular therapy. We touched on diagnostics, but what about treatment?
Siemens has their Healthier DT of the heart. It creates these incredibly detailed 3D images and simulates heart physiology. This allows AI to help devise personalized treatment plans.
So the cardiologist could test interventions on the virtual heart first.
Precisely. Test different drugs, different device placements, see what works best for that specific heart before touching the patient.
That has huge implications for surgery too, I imagine. Planning and simulation.
Absolutely. Much more advanced preoperative planning. Predicting risks like portal hypertension after liver surgery or carotid artery stenosis complications. It could make surgery significantly safer.
And it's not just patient care, right? Hospital management.
Yeah, that's another angle. Using a digital twin of the hospital itself to optimize how resources are used, plan services better, maybe streamline patient flow to cut down waiting times, making the whole system run more efficiently.
Okay, and precision medicine keeps coming up. How do twins enable that?
It's about moving beyond one size fits all. By building that detailed digital model of an individual patient, you can analyze their specific biology and genetics to select the drugs most likely to work for them, with the fewest side effects. Truly personalized prescriptions.
Which ties into precision healthcare more broadly.
Right. Precision healthcare takes that personalized idea and applies it preventatively. Using all this data, population data, personalized data from twins to spot disease risks earlier, contain outbreaks faster, and intervene proactively. It's a shift towards wellness.
Even for specific conditions like sleep apnea.
Yes, obstructive sleep apnea, I want to say. Digital twins could help pre-evaluate different treatments, CPAP machines, oral appliances, surgical options, to see which is likely to be most effective for a particular patient's airway anatomy and physiology before they commit to it. More tailored interventions.
Okay, let's maybe dive a bit deeper into some of those specific medical fields. Cardiovascular seems like a really big one for digital twins.
It really is. The goal is these incredibly precise digital twin heart models. They're not just for visualization, they're for personalized treatment planning, and crucially, for determining diagnostic criteria non-invasively.
Better than current methods.
In some cases, yes. The sources mentioned studies where DT models were more accurate than standard clinical guidelines for calculating things like pressure drops across blocked arteries.
Wow. Are there specific technologies we should know about?
Yeah, several are emerging. Philips has something called Heart Navigator, which uses CT scans for real-time 3D guidance during procedures. There's heart flow analysis, which gives functional data about coronary artery disease.
Functional data, like how well blood is flowing.
Exactly. And the ACORIS mapping system does non-invasive ECG imaging. These are all tools building towards that complete digital twin heart.
And simulating treatments, like testing drugs or devices virtually.
Right, that's a huge advantage. FIOP's Heart Guide, for example, can predict how an implanted heart valve, like from a PVI procedure, will interact with the patient's specific anatomy after it's implanted.
Predicting fit and function.
Yes. And AI is being used more and more to analyze anatomical data within these twins to manage structural heart disease better throughout the whole process.
What about more complex heart issues, like rhythm problems?
Applications there too. For cardiac resynchronization therapy, or CRT, mechanical models are helping figure out who will benefit most and how effective it might be. For dangerous arrhythmias like ventricular tachycardia after a heart attack, digital twins are being used to guide ablation procedures, pinpointing exactly where to target the treatment for that patient.
So, really precise targeting.
Extremely precise. And there's even research, like Mazumder et al.'s work, creating a DT of the whole cardiovascular system to generate synthetic data.
Fake patient data, why?
Well, realistic synthetic data is incredibly useful for training AI models and testing new ideas without needing vast amounts of real patient data, which can be hard to get and has privacy issues.
Okay, that makes sense. Let's shift gears to surgery. What's the big picture goal there?
The main goal seems to be creating these super detailed, patient-specific models that the whole surgical team can use.
Like a virtual dry run.
Exactly. For planning every step, double-checking the anatomy, and really importantly, figuring out how to avoid damaging anything unintentionally.
Are these twins also helping develop new ways to diagnose surgical issues?
Yes, definitely. New diagnostic tools are emerging. There was an example from Chakshu et al. Using a DT model that analyzes facial videos.
Facial videos?
Yeah, facial videos combined with blood flow and head vibration data, believe it or not, to estimate how severe a carotid stenosis is, a blockage in the neck artery.
That's unexpected.
Isn't it? And another example, Suzuki et al. Developed a model using clinical info and blood flow simulation within a DT to predict the rupture risk of brain aneurysms, using the virtual twin to see risks you couldn't easily measure before.
And during the actual surgery, how are they used then?
Companies like Simoncure use 3D modeling based on the patient's twin to plan aneurysm treatments, figuring out the best way to place implants like stents or coils.
Optimizing placement.
Right. And SIDAR has intelligent maps. Think of it like a GPS for surgeons, overlaying the plan from the digital twin onto the real view during minimally invasive procedures using cloud graphics and AI.
Enhanced vision for the surgeon.
Precisely. And research is ongoing to predict post-op problems too, like Golcial's model trying to predict portal hypertension after liver surgery.
And training. I assume VR and DTs are a good match there.
Oh, absolutely. Integrating digital twins with VR platforms creates incredibly realistic training scenarios. Surgeons can practice complex procedures, get feedback, and be assessed, all in a safe virtual space based on realistic patient models. It's a game changer for surgical education.
Okay, what about orthopedics? Bones and joints.
That's another growing area. A key focus is real-time monitoring and analysis, especially for things like the lumbar spine. The advantage here is combining physics-based models how forces affect the spine with data-driven models from sensors.
Getting the best of both worlds.
Kinda, yeah. A more complete picture. And there's interesting work like Croati et al. Using agent-based digital twins, that's multiple interacting AIs, to help manage severe trauma cases, integrating different AI approaches for complex situations.
Using the twin for decision support in emergencies.
Potentially, yes. And these orthopedic models provide actual numbers, quantitative data, to help clinical decisions.
Like quiet.
Like Ober et al.'s work simulating fracture risk. They take post-op 3D X-rays, build a twin, and then virtually test how stable the fracture repair is under different conditions.
Predicting if the repair will hold up.
Exactly. And Hernigo et al. Developed a patient model using CT scans, AI, and DT that reduces the need for doctors to manually identify anatomical landmarks, improving accuracy and speed in diagnostics.
Interesting. The sources also mentioned COVID-19. How did digital twins play a role there?
Well, a couple of ways. Zodi developed an approach combining models of how respiratory droplets spread with a digital twin of a space, like a hospital ward, and used machine learning to figure out the best ventilation setup to minimize virus transmission in that specific space, optimizing airflow using a virtual model.
Smart. And vaccinations.
Yeah, Pilati et al. Created a digital twin specifically for the vaccination process.
Like the logistics.
Exactly. Simulating the flow of people through a vaccination center. They could run virtual scenarios, identify bottlenecks like registration taking too long, or not enough vaccinators at peak times, and fix them before opening the real center, making the whole campaign smoother and more efficient.
That's a clever use case. So pulling this all together, the potential for more accurate diagnosis seems immense.
It really is. The idea is to build this comprehensive digital twin of a patient using all the available data.
Medical scans, wearables, lab tests, everything.
Everything, and crucially, integrating it all. Not just having separate buckets of data, but understanding the connections, how genetic factors link to protein levels, how environmental triggers like allergens affect respiratory function in an asthma patient's twin, building these complex multi-layer models.
So it includes the patient's history too, and predictions.
Yes. Historical data, medical records, health predictions from the model, results from virtual surgical simulations, even data from virtual drug testing on their twin. It all feeds in.
And the result?
The result is this incredibly powerful tool that can potentially predict how that specific individual's immune system will respond to an infection, or how they'll react to a certain drug, allowing for truly precise diagnosis and personalized interventions.
It really sounds like it could revolutionize so many aspects of healthcare. Diagnosis, treatment, surgery, running hospitals.
It touches almost everything. And what's really clear from the sources is that this isn't just a medical breakthrough. It's deeply interdisciplinary.
Right. You need the medical experts, but also engineers, data scientists, AI specialists.
Exactly, and ethicists too, which brings us to some of the challenges.
Because while the potential is huge, it's not without hurdles, is it? Data seems like a big one.
Definitely. Just gathering all that diverse data is tough.
Yeah.
Electronic health records are often scattered, unstructured information needs automating, and fusing real-time sensor data with scan data is complex. Data collection and fusion is challenge number one.
And then making sure the simulation is actually accurate.
That's challenge number two. These are models, simplifications of reality. How accurate do they need to be? How do we validate them? We need clear guidelines, standards for evaluating these computational models, plus the whole IT infrastructure to support it. Standardization is key.
And then there are the bigger societal questions. The ethics.
Absolutely. Socioethical considerations are huge. Privacy is probably top of the list.
Understandably. We're talking about the most personal data imaginable. Breaches would be catastrophic.
For sure. And then there's the cost. Developing and implementing this technology is expensive, at least initially. Could it end up making healthcare less equitable, widening the gap between those who can afford it and those who can't?
That's serious concern.
It is.
Yeah.
And finally, just educating people, patients, the public, about what this technology is, how it works, and addressing those privacy fears head-on is going to be vital for building trust and acceptance.
So it's clear digital twins offer some truly exciting possibilities for transforming healthcare across the board.
Absolutely. From spotting disease early, to planning complex surgeries, to running hospitals more smoothly, the potential is vast.
But it really underscores that need for collaboration, medicine, engineering, data science, and also careful thought about the data, the accuracy.
And the ethical implications.
Yeah.
It's a complex landscape to navigate as this technology develops.
Which leaves us with a final thought for you, our listener.
Yeah, something to consider. Given this potential for digital twins to predict our individual health paths, maybe with surprising accuracy, how might that fundamentally change how we all think about personal health and preventative medicine?
What new responsibilities might fall on us as individuals or on healthcare systems?
If your virtual twin flags a high risk for something years down the line, what do you do? What should you do? It opens up some big questions about the future of well-being.
Thank you, viewers, for watching. If you found this video helpful, don't forget to hit that like button and share it with your colleagues. And if you haven't already, make sure to subscribe to the channel by clicking that subscribe button below so you never miss out on valuable insights. I'm Brian Edmonds, signing off. See you in the next one.